So I'm gonna go ahead and do the urinary catheterization video. So before doing this procedure, I'd make sure that I have my catheter kit. I have my blue, it's not a blue pad, but it's still a pad to put underneath the patient. I have my sterile gloves, and I have my clean cloth and my, this is gonna be like my perineal cleaning solution. And I would make sure to be in proper uniform attire, so scrubs, hair pulled back, and I'd make sure to have my badge visible. I am wearing a gown because I am gonna be dealing with urine, so I wanna make sure I protect my uniform. Depending on what the patient's contact precautions, I'd either have gown, mask, goggles, gloves, but for now I would say that he'd be standard precautions, so I would just use a gown. So I would first start off by knocking on the patient's door, introducing myself. Hi, my name is Acacia. I'm going to be your student nurse for today. Pull the curtain, provide for privacy. I would then go ahead and start by performing hand hygiene. So I want to go ahead and first identify the patient. So I would look on both arm bracelets to see where that patient name tag is. Sir, could you please state your name and date of birth? Perfect. Do you have any pain or allergies, specifically to latex or iodine? Sometimes some of the lubricant, or not the lubricant, the tubing in the catheter kits can have latex, and if the patient is allergic to that, that's obviously very important to know. So I'm going to first start off by, so if he said that he didn't have any allergies, then I would go ahead and document that. Do you have any pain today? 0 being the least amount of pain, 10 being the most amount of pain. And if he said, no, I don't have any pain, then I would just go ahead and document that as well, make note of it. So I would want to first make sure that the patient's bedside or bed is at or above waist level. So that's good. So I want to make sure that the patient's bed is at or above waist levels, because I am going to be doing my sterile field. So first things first, I want to put clean gloves on. I would want to note in the patient's chart what he can and cannot do, because I am going to put him in dorsal recumbent position. So if he could help me lift his legs, then I would ask him if he could, and if he couldn't, then I would either do it myself or ask someone else that could help me. We have a little pattern here. And I would want to make sure to have a trash can in my site, because I am going to be needing that probably. So first things first, I'm going to provide as much privacy for the patient, but I want to put a blue pad, but a pad underneath the patient, so that way it can protect his bed. So I'm going to just go ahead and lift his legs for him and place this underneath. Okay. Now we're good. Okay. And I would also so I'm going to go ahead and say, okay, sir, I'm going to go ahead and lift your legs up, and I'm going to put you in dorsal recumbent position. And this is to make sure that his legs are open wide enough, so that way when I do the procedure, I have enough space to work with. So, and I could, yeah. So I put my blue pad down. So now that I would want to do is I would then want to clean the perineal area, and that is just to make sure that we just get rid of any, if for any reason he had any accident or anything. So I would then take my clean cloth. I could pour some of the solution on there. It's not really solution, but I'll say that I'll put some on there. And I want to make sure, this is actually a female, so I would want to make sure to clean between, to open up the labia, and I would want to clean in between. And I would use a corner of each, different corner of each cloth between each stroke. So the clean, and I want to clean front to back. Front to back. And I would then also want to make sure to clean in between the labia, just to make sure that area is nice and clean. Okay, so once I finish cleaning, I would want to dispose of that in the patient's hamper. I don't have a hamper here, so I want to make sure I'll just put that to the side. And so once I've done that, then I would take off my gloves, perform hand hygiene. Let that dry. Perform, wear your gloves one more time. So I now have my catheter kit, so I'm going to go ahead and open it up. So as long as I don't touch anything in the middle, everything inside is sterile. The outside is unsterile since I am touching it with clean gloves. I could throw this away. I'm going to use this as my little trash bin. I'll just put this to the side. Okay, I can just put this right here. Okay, so now that I've done that, then I can go ahead and begin opening my catheter kit. So I'm going to start doing, start by doing this side towards me. Well, actually, I'd want to get the first side and do it. And I want to stay with outside the 1 inch, or within the 1 inch border. Be careful not to touch anything in the middle. Make sure this goes underneath. So now that that's there, I haven't touched anything in the middle, so that is still sterile. So I would go ahead and take off my gloves. And I would then want to begin the process of putting on my sterile gloves. So I'm just going to perform hand hygiene one more time. And make sure my hands are dry. I can keep my trash bin right here. Okay. So I'd want to make sure that I would have disinfected this with cleaning solution and allowed it to dry, since I'm going to use this surface as putting on my sterile gloves. Oops. Okay, so I'm going to first start with my non-dominant hand. Okay, and then I'm going to use my other hand and I'm going to tuck underneath. The hitchhiker method. I'm going to use fit over my gown. And now with this hand, I can also go ahead and fix it. Okay, so now I'm completely sterile. So I want to make sure I keep my hands above my waist. So now I'm going to go ahead and begin the process of removing so there's these gloves here. I'm not going to need these, so I can just place this to the side. Want to make sure I have my trash can to the side. So now I would begin the process of putting the blue drape. So since I'm still sterile, okay, I could grab this, put that to the side. Okay, there you go. I have not touched, my hands did not touch the patient at all, so my gloves are still sterile. I also made sure I want to go ahead and make sure to tuck this underneath. And so I still have sterility. So now that I put this blue pad down, I want to put the moisture proof down, so that way if any reason there's urine or anything, it still tries to maintain the sterility. So then I'm going to put my fenestrated drape over, and I want to be careful that it does not touch the patient's legs or so. I just want to place it there. Okay, so now that that's there, I'm then going to take my little cleaning swabs and open this up. Okay, I could throw this in my little bin right here. So that now that that's open, I'm gonna just begin the process of I want to be careful with this, that this not touch the patient's leg at all. Okay. And I want to make sure that I place my cup right underneath there, so that way the urine can be collected. I could put my cap as long as I could put it here to the side. I would then open up my lubricant. And lubricate it 1 to 2 inches. So now that I'm almost ready to start the process of putting in the catheter. I'm now gonna put my non-dominant hand, and I'm gonna keep the labia open so that way that I can go ahead and clean. So I would go ahead and just open it up. So I actually made a mistake. So before even putting the fenestrated drape on, I would have made sure to have cleaned with the swab sticks. So I'm just going to go ahead and just clean around the area. So I want to keep it open. okay? And I want to clean front to back while keeping this open because I do want to get any bacteria that might be in there. So now that that's clean, I'll give it some time to dry, to allow it to clean or to dry. So now that that's done, I can then go ahead and take this and dispose of this as well. So now we'll begin the process of putting in the catheter. So I'm just going to explain to the patient, okay? I'll let you know when I'm going to begin putting in the catheter. You're just going to breathe deeply, and whenever you're just going to act like you're bearing down. And just relax. So I would then go ahead, it's lubricated. I would then go ahead and open up the labia as much as possible. And I'm going to put it into the urethra. So I want to make sure that I keep that open. And I'm not going to let it go until the catheter is in. So now it's lubricated. And I'm gonna just, okay, tell the patient, okay, relax, act as if you're bearing down. Insert it. Okay, relax, 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 relax. And I will stop until I see urine. If for any reason there is blockage, or I could lightly retract and try to reinsert it again, but if there's still resistance, and I wanna go ahead and immediately remove it, because that could damage the lining of the bladder. So I'm just going to go ahead and hold on to that. I'm not going to let that go. And I'm going to go ahead and once the patient has urinated and I have enough for my collection, I will then go ahead and remove the catheter. Okay, just relax, relax, act as if you're bearing down. Okay, I'm going to go ahead and then remove that, and I'm gonna then go ahead and grasp the catheter with this hand, and I'm gonna remove the glove. And I'll just dispose of that. I'll then go ahead and perform hand hygiene, still keeping my my eye on the specimen collection. And I'll go ahead and grab some gloves. Again, it's important to keep your eye on the specimen collection because if it does go to the lab, you need to make sure it stays with you at all times. Put new gloves on. So now that I have gloves on, then I'm going to go ahead and grab my specimen collection. I want to make sure to put the cap back on. Make sure it's tightly sealed. While looking at the urine, I'm also going to look at the odor, color, consistency, and make any necessary documentations if there's any bacteria present or blood. And so I'm going to make sure that the patient's name, date of birth, and information matches the bracelet. Also put my name and the initials and keep it with me. And right after I'm done cleaning up, so I'm just going to go ahead and clean up, but I want to make sure to just keep the specimen with me since I will be the one taking it to the lab. So I'm just going to go ahead and clean up, dispose of all this. Put that in the trash. I would then go ahead and take this blue pad. I could also grab another cloth or wipes and clean any excess gel, or if the patient needs to be cleaned up more, then I'll make sure to clean them up. I would then remove this pad here and throw that away as well. So I dispose of all my equipment according to policy. Just make sure I clean up the patient's table. Again, make sure that I just keep my eye on the specimen collection. Put the patient's legs back down. I'd want to go ahead and put the patient's down comfortably. Make sure the patient is in a comfortable position. I could then go ahead and put the patient's bed all the way down to lowest position. I would ask the patient if they felt any pain during that procedure, or how they feel like it went. Ask them if they needed anything, any water. So I'd want to also make sure the call light is in place. Again, I would make my documentation on how the procedure went, and also any notations that I noted on the specimen collection. I would then remove my gown. I'm going to dispose of that. Make sure I leave the patients in a clean make sure it was left like when I came in, and ask just the patient if there's anything else that they need before I leave. And if there's not anything else, then I'll just go ahead and perform hand hygiene and then exit the patient's room with my specimen collection and take it to the lab.